So from the standpoint of newly diagnosed patients, the audience knows that transplant is clearly an important part of myeloma therapy, and data on that are looking at the IFM, I know, has some new studies on really minimal residual disease, and using that as a tool in the treatment of patients with myeloma. What are your thoughts on that study?
Yeah, so this is an update. It's presented by Hervé Avelloison from the French group, and they have done very important work for very many years, and this is just another great study they have done. They actually published the first paper on the same population just a few months ago in the New England Journal of Medicine. And this study was designed to look at the combination of bortezomib with lenalidomide and dexamethasone after 3 cycles, transplant, 2 more cycles, and maintenance, versus giving 3 cycles, collect the cells and keep them in the freezer, and do 5 more cycles of the same therapy, and then maintenance. So they were looking at the use of transplant up front versus keeping it and use it as rescue.
Right.
And the primary endpoint in that study was to look to see 3 years out, is there a difference in progression-free survival? And the answer is yes, and the winner was transplant. So when this was initially presented at ASH, I think that half people who listened to it heard that transplant won, although that was the winner. The people who heard that transplant lost were the people who went to the second presentation by the same group. Because what they had done was that they stratified the data by response in the 2 arms. And they had preliminary data at the time showing that MRD negativity was achieved in both arms. More people in the transplant arm than in the other arm. But if you were MRD negative, that was the very similar progression-free survival. And that's exactly what this new abstract is looking at. And now they have kind of taken it to the new level. They have used sequencing-based data, not only flow cytometry data. And I think this abstract is important. It really kind of pushes the field even more in the direction of what Anas was talking about before. What's going to be the role for just throwing chemotherapy on every patient in the future? Is that really where we are going to go? Or can we use markers to determine the use of that? So I don't pretend to know the answer to it, but I think the data here is very provocative, and it suggests that maybe transplant could be given in patients where there is still detectable disease. And that's what they suggest in their abstract.
Great. And then just 2 quick other points about transplant. There were two other studies, one on secondary malignancies and one talking about lenalidomide maintenance in both in transplant and non-transplant settings. Just the quick takeaways from that.
Yes, so the second paper, or the first of those 2 you mentioned there, the second malignancy paper, this is a large database that looks into patients in California. There were close to 19 or 16,000 patients. And they found 900 of them to develop a secondary malignancy. And that was recognized many years ago in myeloma, that there is an over-risk for malignancy, in particular hematologic malignancies. And the papers that came out in the 70s, they were accusing alkylators. And then for a while, people forgot about it, and the therapies were not that good. And then when lenalidomide maintenance came into practice around the 2010 or so, people started looking into it again, and there was signal. So this study looks into patients treated with and without a transplant up front. And they look at 5 and 10 years of cumulative incidence of secondary malignancy. And they show in this study that at 5 and 10 years of follow-up, the cumulative incidence of secondary malignancies are 4 versus 7% in the non versus the transplanted patients. You double basically the rate of secondary malignancy in these patients. And they show that the particular increase is in the patients that are transplanted with regard to hematologic malignancy. So they say maybe that's another reason for thinking about other therapies.
Great.